Reducing Inequalities in Communities is a movement of people and projects who are working together to close the health gap in central Bradford. One of these key projects is the Central Locality Integrated Care Service, CLICS for short. CLICS is designed to help people improve their health and well-being. It recognises that a person's health and how they feel can be affected by a number of things, most of which cannot be fixed by medicine alone. In our CLICS teams, we have people with medical expertise and skills, these are called advanced practitioners, and people with strong links into community support and services. These are called community connectors. They work together to help people to take a more active role in their health and well-being. This is the story of Tania. Tania lives in central Bradford. She went to see her GP about her low mood and housing issues, which were affecting her health. The GP realised that she would benefit from being seen by the CLICS team, and Tania agreed. Vicky, an advanced practitioner, and Ellen, the community connector, work in the practice's CLICS team. They looked at Tania's information and agreed that they could work together to help with her medical and social needs. The CLICS service is designed to allow more time and regular contact with a person on the caseload, giving the team members the opportunity to work with a person to explore their needs and develop a joint care plan. In their initial conversations with Tania, Vicky and Ellen found that she was upset and distressed. By listening and talking things through, it was clear a number of things were affecting how she was feeling. She was already prescribed antidepressants, but hadn't had a recent review of dose or effectiveness. A number of long-term health conditions were affecting her mobility, and she wanted to move to a bungalow as she was struggling with the stairs. She had to phone housing services daily to bid for properties so she could be rehoused. She was feeling increasingly low in mood due to frustrations with her housing situation and a difficult neighbour, resulting in sleepless nights. She was also grieving due to a recent family bereavement and was upset and worried for another terminally ill relative. Due to the current pandemic, she was experiencing social isolation with very little contact with friends and family. She was also worried about her physical health because of reduced appetite, changes in bowel movement, and weight loss. CLICS is a unique service which combines the expertise of general practice teams with the expertise of communities. Working together, Vicky and Ellen were able to use their skills and experience to identify and access a range of services that could work with Tania to help her improve her health and well-being. They arranged urgent investigations for the physical health concerns identified. They carried out a mental health assessment, changed Tania's antidepressants, and made a referral for a more specialist assessment with the community mental health team. They offered encouragement, advice and guidance so Tania could explore her housing options. They provided a supporting letter to strengthen Tania's application to another housing provider. They gave Tania the contact details of support organisations to contact for wellbeing and bereavement support. They supported and encouraged Tania to follow through with her health appointments. Tania is still being supported by the CLICS team, who can already see the difference. Understandably, she is still dealing with the loss of her family members, but she now appears more motivated and positive. She has reached out to old friendships for support, which is helping with her mood and reducing her feelings of isolation. She is independently contacting agencies for support with her housing issues. She is completing the final investigations looking into the physical health complaints identified. The team continues to support Tania, but the contact she needs is less frequent as she's taken control of her own health and well-being. Tania's story is a CLICS success story. It's evidence in action of how the RIC programme is working to close the health gap so everyone can live healthier and happier lives.